What's the distance that you should have between one implant and the other? So you need to know that. Yes, as a patient, yes, because many patients ask, hey, did the doctor place that implant correct? Well, things you need to know. When you're placing implants, we wish that everything would be straight and beautiful. Sometimes you can have some bone that is not straight, and then when you're placing implants, they can be like that, or they could be straight, or they can be like that. That's why you always, when you're placing implants, is not only seeing them like that, because it could be on this position and they can be like that. Do they have the proper separation? Yes, but not here on the occlusal area, or sometimes you place them like that. So this will depend a lot on the skills of the doctor, and also how the bone is, how much distance you need to have. Well, at least 3 millimeters from one border to the other border. This is what you need to have from here to here, at least 3 or 4 millimeters. That will depend. It's going to be different if you place them in the anterior area, because it has a different shape, the bone there. Now, when we have implants placed on the posterior area, sometimes you can have a wider implant and probably a not so wide implant. It could be a 4 and a 5, or it could be sometimes in some areas where you can probably had a defect, you can probably place a more narrower implant here and a wider implant there. Anyhow, at the end, what you need to have is, doesn't matter if you put an implant here and another implant here. At the end, the restorative work will depend a lot if you're going to make them individual or fused together. This is something that you need to talk with your doctor before they do the work, so there's no surprises. You will have, or rather, 2 crowns, so you can floss in between, and we know that those implants, they need to go all the way in, as you see there, like that, because they merge from the gum like that. Sometimes when they are obviously bone level, they will merge out, and that's what the way that you're going to see them. And you can do individual crowns, or you can do implants, but that's technically the distance you have to have a good margin, to have a good cleaning, good hygiene, and they work really good. Do your homework. If you're searching for a doctor to place implants, they need to have lots of experience. Bye, Dr. A.